You know, we've now been at this for 9 months, right? So I think it's a physical bearing on us. It's a spiritual and emotional bear as well.
They are responsible for the care of BC's COVID-19 patients. A Vancouver doctor who works in the ICU is giving us a look at what it's like to work on the front line of the pandemic. As the second wave hits us hard and hospital beds fill up.
I mean, it's really hard being on the inside and believing that it's actually going to end.
Exhaustion and fear, two of the overarching feelings Dr. Del Dorscheid says he himself and his co-workers are experiencing while helping patients at Vancouver's St. Paul's Hospital.
A lot of staff are requesting transfers out of the most acute units. Just the wear and tear every day of getting into the PPEs, living in the PPEs, getting out of them, wondering if you're going to take it home with you to your family, to your loved one, to your children.
If every British Columbian maybe stepped into your shoes for one day, what do you think they'd walk out thinking?
Most people haven't seen critical illness, right? So I think that's kind of horrifying to most people when they see it for the first time. Then to actually realize a number of those people that have COVID, they may or may not have other medical problems, but those weren't the reasons why they got into the ICU. They got into the ICU because of COVID-19.
Another reality many in the intensive care unit with COVID-19 have to face is the use of ventilators to assist in their breathing.
The best analogy for me is if you were to take your finger and jam it on the back of your throat and just leave it there. 24/7 gag reflex, and it is painful. And, you have this machine which is forcing air into you. Right. So you're not gently taking a breath in. It's actually a forceful maneuver with this finger on the back of your throat.
294 people with COVID-19 are in hospital across the province as of Wednesday. That's the highest hospitalization number we've seen during the pandemic. 61 of those people are in critical care.
At St. Paul's, on all of our healthcare systems are starting to feel stretched right now. Having said that, in terms of people getting care, the emergency departments are safe. They're still able to function. And we have a backup plan and the surge plan across the Lower Mainland and across the province to support what we need to do for hospitals, for people who need admission or surgeries.
I think that, in the Fraser Health Authority, they, for the last sort of 4 to 6 weeks, have had about 75% of our cases, and they're getting full. The coastal, we're doing okay yet. So there are some places in Canada that are getting very full. I think in BC, we still have time. But if we don't, to use the old phrase, if we don't flatten the curve, we will fill up pretty quick.
Ashley Burr, City News.